Okay, welcome to the April 26, 2022 Legislation and Regulation Committee meeting. My name is Sung-Oh, chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted in a hybrid fashion. As included on the agenda, members are participating in two public locations, one in Sacramento and the second location in Los Angeles. Members of the public may participate in person at either of these locations or via Webex using the link provided on the agenda. Participants watching the webcast will only be able to observe the meeting. Information and instructions are posted on our website to join the Webex as well as the webcast. Members of the public in LA who want to inspect the materials for the committee meeting should go to the board staff in LA to inspect the committee materials if needed. As I facilitate this meeting, I will announce when we're accepting public comment. I have advised the meeting moderator to allot 2 minutes to each individual providing comments. As public comments are taken, I intended to first accept public comment from these individuals attending in person at the Sacramento location, followed by those individuals attending in person at the Los Angeles location, if there is any, followed by those individuals participating via Webex. I will remind members and the public at appropriate times throughout the meeting. I would like to ask staff moderating the meeting to provide general instructions to members of the public participating via Webex. Moderator?
All right, for the purposes of today's meeting, when the chair or president opens public comment, members of the public who would like to provide public comment at the DCA headquarters location in Sacramento can approach the table and microphone at the front of the room. For those participating at the Los Angeles location, you can let the committee, board, or staff member at your location know that you wish to make a comment by raising your hand. When you're called upon, you will ask that committee or board staff member to present provided commenters to access your microphone. For those joining on Webex, we will be utilizing the Webex question and answer feature in the raise hand feature to facilitate public comment. When public comment is called, I will call upon the question and answer feature, which you will hear me refer to as Q&A. And the members of the public who wish to make a comment can then click on the Q&A icon, type the word comment in the text box, and then click the send button. To utilize the raise hand feature, simply click on the hand icon next to your name to raise and lower your hand. For those who have called into the meeting, you can press *3 on your device to raise or lower your hand. We'll have those instructions displayed on the screen during public comment, and after public comment is taken from Sacramento and Los Angeles, we'll then call on the individuals in Webex. Each individual will have 2 minutes to speak to make their comments, and I'll provide a 10-second reminder when the allotted time is about to expire. At the conclusion of 2 minutes, the microphone or the individual's microphone will be muted, and we will move on to the next person who has public comment. And those are all the instructions that I have.
Thank you, moderator. I would now like to take a roll call to establish a quorum. Members, as I call your name, please remember to open your line before speaking. I will start with members present in Sacramento location, followed by members present in the Los Angeles location. In Sacramento, Maria.
Maria Serpa, licensee member.
Thank you, Maria. Good morning. And then moving on to Los Angeles location, Cheryl.
Cheryl Butler, licensee. Thank you.
Good morning, Cheryl. Jose.
Jose de la Paz, public member.
Morning, Jose. Shirley. I believe Shirley is not joining today. Nicole. And I believe Nicole is not able to join either, and I am here. The quorum has been established. Members, we have a full agenda for our meeting today, including consideration of a number of legislative measures. I truly appreciate all of your time and commitment to the board and California consumers. I ask everyone participating today to be respectful of the work before the board today. We encourage participation by members of the public throughout our meetings at appropriate times. The board respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the board conducts its business. I will now open the meeting for public comments for items not on the agenda. I would like to remind members of the public that you are not required to identify yourself, but may do so. I would also like to remind everyone that the committee cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. I will first open up to public comments for individuals attending in person at the Sacramento location. It seems like we do not have anyone participating today in person as of now. I will open for public comment.
President O, this is Debbie. Yes, that is correct. There are no members of the public in LA. Sorry for the interruption.
Thank you, Debbie. Okay. So there's no public comments here in Sacramento nor LA. I will open for public comment for individuals participating via Webex. Moderator?
All right, this is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment for items not on the agenda, please click that Q&A icon located at the bottom right-hand corner of your Webex screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, it appears there are no requests for public comment. Would you like me to close that Q&A panel?
Thank you. Thank you, moderator. Now, since there is no public commenters present in LA, is it okay for us to proceed without constantly asking if there is any during the meeting, Ms. Smiley?
For the public comment, I think what we should start, because people could start to
Can I
arrive.
ask LA location to tell us if there is any? Okay. All right. So we will see how that situation moves on so that we don't interrupt and waste too much time. So, all right. With no public comment, moving on to agenda item 3, approval of January 18th, 2022 committee meeting minutes. Members, included in the meeting materials is draft minutes from our January 18th, 2022 committee meeting. As we begin, I will ask members if there are any questions or comments on the draft minutes from the January 18th, 2022 meeting. I would also entertain a motion, again, starting. So members, I think initially I wanted to do by locations, but I'm going to see if members can just announce their name and speak so that we could hopefully have a more smoother discussion. So if any members would like to have any comments, just identify yourself before speaking as if we were doing it via Webex. So if you could just kind of identify yourself and speak if you have any comments or motion.
Hi, President O. This is Jose de la Paz. I make a motion to approve.
Thank you, Jose. Maria, do you have a comment?
Yes, I have 2 corrections.
Go ahead, Maria.
The first correction is on the minutes on item number 3, page 1 of 12. It has the wrong committee listed. I think it's just a typographical thing. If you look at, it says Enforcement and Compounding Committee minutes, and it's really leg-reg. And the second correction is on page 8 and 9. It looks like a cut and paste. Big chunks of the minutes are missing that are attachments. So I believe that's also a typographical technical issue. That's all.
Okay, thank you, Maria. Jose, are you okay amending your motion to reflect? Okay.
I would amend my motion to reflect the corrections.
Thank you, Jose. Anyone second for Jose?
This is Cheryl Butler, and I second.
Thank you, Cheryl. Appreciate that motion and second. Okay, with the motion and second, any other member comments? Oh. Okay, with none, we're going to open up for public comment in Sacramento location. Anyone in Sacramento would like to make a public comment? Okay. And there are no public present in LA still. So, moderator, if you could please open the line for public comment.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. With a motion and second and public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose. And I vote yes, the motion passes. Okay, moving on to agenda item 4, discussion and consideration of pending legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. As indicated in the meeting materials, there are 18 measures for our consideration. As legislation is very dynamic, there have been some changes to measures since the release of the meeting materials. In general, I do not plan to extensively read the information contained in the meeting materials. However, where changes have been identified, I will highlight them for members. I also note that the staff have offered recommendations on several of the measures. Should you agree with the recommendation and or believe another position is appropriate, I would welcome motions as part of your comments on each measure. The recommendations we vote on today will be considered by the board tomorrow. Okay, starting with Assembly Bill 646, Low, Department of Consumer Affairs Board, Expunged Convictions. This measure relates to posting of disciplinary actions stemming from a conviction of a crime where the individual's underlying offense is subsequently expunged pursuant to Section 1203.4 of the Penal Code. Specifically, within 90 days of the receiving expungement order, the board would be required to take specified actions, including no changes have been made to this measure since the release of the meeting materials. I agree with the staff recommendation to monitor for amendments. I also agree with the staff's recommendation to consider changes to the board's current petition requirements if this measure is ultimately signed by the governor. Members, I would appreciate your comments on Assembly Bill 646. Also, if you feel establishing a motion is appropriate, I would be more than welcome to listen to the comments. Members, any comments or questions?
None for me. This is Jose.
Okay.
And none
All
for me.
right.
This is Cheryl.
Sounds good. Thank you, guys. Thank you. All right, with that, we're moving on. So we're going to take a public comment for Sacramento location on the Assembly Bill 646. Okay, with no public comment, we're going to go for public comment on Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. Okay, moving on to Assembly Bill 1328, Irwin, Clinical Laboratory Technology and Pharmacist. This measure would amend several provisions of the Business and Professions Code to expand the authority for pharmacists to perform CLIA waive tests, either approved or authorized by the FDA upon patient request or hospital authorization, provided that there is a valid and respective CLIA certificate of waiver and laboratory license, with some exceptions. Further, this measure would amend pharmacy law to declare that pharmacy practice is a patient and public health-oriented health service that is continually evolving to include more sophisticated and comprehensive patient care and public health activities. There have been no changes to the measure. The board previously established a support position. I believe this position is appropriate. It is my understanding that the author's office will make a decision on moving the bill later this year. As such, I do not recommend any action at this time. Members, I would appreciate your comments on AB 1328, if any. Also entertain a motion if you believe establishing a different position would be appropriate. Again, starting, any members in Maria or Cheryl, Jose, any comments?
No comments from me, this is Jose.
All right, thank you, members. We're going to open up for public.
Cheryl.
Oh,
No
thank
comment.
you, Cheryl. Thank you, Cheryl. Okay, we're going to open up for public comment in Sacramento location. Okay, all right. And just a reminder for our LA location, if there is any public comment, please stop and interrupt us and let us know that there is a public present. So thank you over there in LA. All right, we're moving to open up for Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that raise hand icon, or Q&A icon, or use the raise hand. And it looks like we do have an individual who has used the raise hand icon. So one moment while I get my timer ready. Individual identified as Paige Talley. Paige, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now.
Moderator, this is Paige Talley with the California Council for the Advancement of Pharmacy. And all I wanted to say, it won't take 2 minutes, is that we were in support of this legislation last year, and we're in support of it this year as well. Thank you.
Thank you, Paige.
All right, this is the moderator. Appears there are no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you. Okay, moving on to Assembly Bill 1662, Gibson Licensing Boards, Disqualification from Licensure, Criminal Conviction. Members, AB 1662 would allow a prospective application to request a pre-application determination based on information provided by the prospective applicant regarding their criminal conviction, would require the board to determine if the prospective applicant could be disqualified from licensure based upon the information submitted with a request. There have been no changes to the measure, but I note that the measure is being considered today as part of the Assembly Business and Professions Committee. After considering the information, I agree with the staff recommendations to establish a support if amended, and agree with the recommendation suggest amendments to the measure would include as part of the notification of the board's determination that such determination could change at the time of application should the board subsequently receive additional information through the application process. That's a mouthful. Given it is anticipated there will be fiscal impact, I believe it is also appropriate to consider if it would be appropriate to assess a fee to perform the service and to request amendment to the measure to explicitly state that the board has the authority to promulgate regulations necessary to implement the provision. Members, I would appreciate your comments on AB 1662. I would also entertain a motion if you believe establishing a position would be appropriate. Against any members? Any comments?
This is Maria Serpa. I would move that we adopt the support if amended position.
Thank you, Maria.
This is Jose de la Paz. I do believe we need to reintroduce an application fee to mitigate the, financial impact for that half FTE that's anticipated as well. So amend it would be the position I would take.
Okay, thank you, Jose. All right. Are you confirming that as your second, if the amended
Yes.
position? Okay, thank you, Jose. Maria motions, Jose seconds. All right, any other member comments? Okay, hearing none, we're going to go open up for public comment in Sacramento location. Okay, no person here in Sacramento. We're going to open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand icon. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you, moderator. With a motion and second and public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose, and I vote yes, the motion passes. Okay, the next measure is Assembly Bill 1733 would expand authority for the board to convene meetings held entirely by teleconference under specified conditions, which are detailed in the report. Regrettably, the hearing on this measure was postponed by the committee. I am concerned that this measure will not move this year as the policy deadline is later this week. But I still agree with the staff recommendation to support the measure. The data provided in the meeting materials demonstrates that remote meetings expand access to participation in meetings, including by individuals who may not otherwise be available to participate because of health, costs, or other barriers. This transition has also provided benefits to members and staff by eliminating travel time, travel expenses, and et cetera, which resulted in a reduction in costs associated with public meetings, including a reduction in room rental costs and travel expenses. Such meetings also assist board members in attending more meetings without the same degree of interruption in their full-time employment caused by travel to physical locations. I also note the financial benefit to the board includes a reduction in annual expenditures. I would appreciate your comments on AB 1733. I would also entertain a motion if you believe establishing a position would be appropriate against members. Anyone willing to make a motion or any comments?
This is Jose de la Paz. Just one comment.
Go ahead, Jose.
Section 3F, and I would suggest making an amendment to remove 18 years of age or older. So, disclosure of anyone present in the room would be a recommendation I would make, eliminating the 18 years or older. But that's just my comment.
Okay, thank you, Jose. Are you okay to make a motion to support it all, if amended?
I'd like to make a motion to support.
And I would second.
Okay. Thank you,
This is
Cheryl.
Yes.
And this Jose, I second.
Thank you. Is the motion support, if amended? Could you just clarify the amended part, Jose, on the...
Sure. So the Section 3F states that a disclosure whether any other individual 18 years of age or older are present. So my recommendation is to remove 18 years of age or older are. So striking that, making it any individual that is present in the room would need to be disclosed.
Okay, thank you. Thank you, Jose.
Point of clarification.
Go ahead, Maria.
It sounds like they're making a motion to support if amended versus support. So just to clarify, what is the motion?
I think, okay, go ahead, Jose. Support if amended, striking out 18 years, I believe.
The motion was made by
Yes, that would
Cheryl.
be my motion. This is Cheryl.
Okay.
Yes.
Are you agreeable to the Jose's
Absolutely.
Absolutely.
request? Okay.
Yes.
Okay. So Cheryl makes a motion, support if amended, striking out 18 years of age. Jose, are you okay with that?
I second. Yes.
Perfect. Okay, thank you. All right. Okay, all right. Thank you. So with the motion and second, any other member comments? Okay, hearing none, we're going to open up for public comment in Sacramento. Okay, no
And
one.
President, note, just as a quick note, we do have a member of the public in Los Angeles now.
Oh, thank you. Okay, I will now stop at each time to solicit comments for LA. So with that, any public comment in LA? Just let us know if there is any. Thank you. And then we're going to go for public comment in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand icon on your device. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you so much. Okay, with the motion and second and public comment, we're going to go for the votes. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. And I vote yes, the motion passes. Okay, moving on to Assembly Bill 1795, Fong. AB 1795 would require the board to provide all persons with the ability to participate both in person at a physical location identified in the agenda and remotely as defined in any meeting and to address the body remotely. I note this bill would not make other changes similar to AB 1733 to allow greater flexibility for board members to participate remotely. I agree with the staff recommendation to establish no position on this measure. As with the meeting today, the board made a decision to enable the public to participate remotely as well as in person. I note that unlike AB 1733, there is no reduction in board costs associated with this measure. Any comments on AB 1733, members? I'm sorry, AB 1795. Okay, hearing none, we're going to go open up for public comment in Sacramento. Okay, any comment in Los Angeles?
None at this time.
Okay, thank you guys. All right, we're going to open up for public comment in Webex.
All right, this is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. Okay, moving on to the next bill, Assembly Bill 2055, Low. This measure was amended on April 21st. As amended, the measure would move the cure system from the California Department of Justice to the board. As amended, the transition would occur on April 1st, 2023. The measure would provide the board with authority to adopt emergency regulation as necessary to reorganize, clarify, or make consistent regulations, including regulations previously adopted by the Department of Justice. Staff recommended a support position on the initial version of the bill. I agree with the comments included in the meeting materials that CURES is a vital system for healthcare providers to provide safe and appropriate care. To the extent rehoming the CURE system facilitates more robust use of the CURE system and improved functionality for pharmacists and other healthcare providers, such a move appears appropriate. While I believe this would be a significant undertaking for the board, I believe the board, given adequate time and resources, could be well suited to manage the secure system. I am concerned, though, about the time frame and transition would recommend that we establish a support position or support of amended and request that staff work to secure additional time to transition the system. The measure is being considered by the Assembly Public Safety Committee today. Members, anyone willing to make a motion? I do believe we should try to solidify the transition time, not of April 1st, 2023, but if this were to go through, maybe something further. So maybe we could do support if amended, but I will open up for comments or thoughts from members.
This is Maria Serpa. I move that we support, if amended, this bill.
Thank you, Maria. And you're amended to, do you have a date in mind, or?
I would leave that up to the president and staff to work with the author of the bill.
Okay, the intent, okay, so your intent on amendment is just further delay of the timing that is appropriate. Okay. Cheryl and Jose, any comments?
I would second that. This is Cheryl Butler.
Thank you, Cheryl. Thank you for the second. Okay.
No comments from my side.
Thank you, Jose. Maria motions and Cheryl seconds for the support, if amended, position. Okay, with that, any other comments? All right, we're going to open up for public comment in Sacramento location. Okay, no takers. Any comment in LA location?
None at this time.
All right, thank you, Jose. And we're going to open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use that raise hand feature. And it looks like we do have one individual who has requested public comment, Paige Talley. And Paige, I will be requesting to unmute your microphone now. You'll have 2 minutes to speak and a 10-second warning.
Thank you, moderator. Paige Talley with the California Council for the Advancement of Pharmacy. We are wholly in support of this piece of legislation and agree with the amended push-out time. Thank you.
Thank you, Paige. Are there any other? Okay.
My apologies. This is the moderator. Appears there are no further requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. Okay, with the motion and second and public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. And I vote yes, the motion passes. Okay, moving on to Assembly Bill 2092 Weber. This bill would establish authority for a general acute care hospital to operate a hospital at home program under specified conditions, which are detailed in the report. Since the release of the meeting materials, the scheduled committee hearing was postponed by the Assembly Health Committee. There's a lot of information included in the meeting materials, including information from CMS. Although staff did not offer a recommendation, I believe if this measure moves, the board needs to seek clarifying amendments to ensure that the board retains its jurisdiction related to pharmaceutical services provided as part of hospital at home programs, and that the board has authority to promulgate regulations. Initially, reviews could be completed on a program-by-program level. However, ultimately, it would appear appropriate for the board to develop regulations in this area to ensure stakeholders have a clear understanding of the requirements. Should programs already be operating in California, it may be necessary for board staff to work with licensees to secure compliance with pharmacy law. Regulations might include medication storage and handling, medication administration, patient self-administered medication, medication labeling, and the use of own medication. Based on a review of the model, staff have identified several legal questions regarding the model and if it complies with current provisions of pharmacy law. I'm also concerned about unfunded inspector resource and believe it may be appropriate to, as part of the amendments, establish a fee. Members, before I open it to other member comments, I want to ask if Chair Serpa of the Enforcement Committee has any information she would like to share for us in this discussion for our purposes. Chair Serpa, do you have any comments for us or any thoughts?
Yes, thank you. As you mentioned, this topic was discussed fairly intensively at the last enforcement and compounding meeting. We had a couple of really great presentations from a national perspective and what's going on at other states. In light of the emerging issue and the importance to patient safety and access of medications, I believe that our board should watch this bill more intensely than just having a none, but actually going with a watch position. So that would be my motion.
Thank you, Chair Serpa. Anyone, any comments or anyone willing to second for Maria?
This is Cheryl Butler. I would second.
Thank you, Cheryl. Okay, so Maria makes the motion to our position of watch, and Cheryl seconds. Any comments? Any other comments or thoughts? Okay, with that, we're going to open up for public comment in Sacramento. All right, we're moving on to LA for public comments.
No comments from our side.
Thank you guys over there, and we're going to open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A feature?
Yes, please. Thank you, moderator. Okay, with a motion and second, motion of watch position and the second and public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose, and I vote yes. The motion passes. All right, moving on to Assembly Bill 2194, Ward, Pharmacists and Technicians Continuing Education, Cultural Competency. AB 2194 would require that at least one of the 30 hours of CE of the required continuing education for pharmacists include participation in a cultural competency course as defined. The bill would also prohibit the board from renewing a pharmacist or pharmacy technician license unless the applicant submits proof of the board completion of at least 1 hour participation in a cultural competency course. The intent of this bill is to help ensure that pharmacists are providing culturally competent care to members of the LGBTQ+ community. This bill is co-sponsored by the California Pharmacists Association and Equality California. After reviewing the information, I believe a support, if amended, position would be appropriate to clarify certification of completion followed by an audit-based approach for compliance would be consistent with the provisions of pharmacy law. Further, based on my understanding, a delay in implementation may also be appropriate to allow time for impacted licensees to comply with the requirements in advance of their renewal. Members, any comments or thoughts on AB 2194? Also entertain a motion if members feel that it is appropriate to establish a supportive amended position.
This is Cheryl Butler, and I would recommend a support if amended.
Thank you, Cheryl. Anyone willing to second for Jose? I mean, so Cheryl, sorry.
Oh, you're already thinking I was going to support it, so I'll second that already.
Thank you, Jose. Appreciate it. This location thing is getting a little challenging here. I hope we don't have 7 locations at one point in our meeting. But all right, with that, member comments? Okay, no other comments. All right, we're opening for Sacramento location for public comment. Okay, I don't see anyone here jumping up down the hallway, so we're going to go open up for public comment in LA.
Yes, we have one speaker.
Okay.
This is Steve Gray. Thank you very much for the opportunity to comment. And I appreciate the challenges that you mentioned, Sung, about the locations and so forth, especially the parking here. I wasn't clear. The motion was support if amended. I wasn't clear what the amendment was, but the amendment I would suggest is that the way it was read by you, the certificate would have to be submitted to the board. And that would be the first time that we had CE certificates that had to be submitted. And I see no reason for that because pharmacists and so forth are allowed to keep their continuing education for 4 years, subject to audit and review and so forth, and I would think this would be the same. So I would suggest a support if amended, because the principle is great, but the amendment should be that the proof should not have to be submitted to the board. What's the board going to do with it? Is it going to go through, 46,000 pharmacist licenses to see, if it was done? So that's my suggestion. Thank you.
Thank you, Dr. Gray, for your comments. That, I believe, is the if amended part of it, which is to request the amendment to align with our current renewal process. So thank you for your comment.
No further speakers from Los Angeles.
Okay, thank you, Jose. Thank you, everyone in LA. All right, we're going to open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I do have one individual who has requested public comment, Lindsay Gullahorn. And Lindsay, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now. And Lindsay, you're unmuted.
Possibly some technical challenges, so if you want to give her another chance over there, and maybe, thank you, Sarah.
This is the moderator. Lindsay, I'm going to try to request to unmute your microphone again. Oh, it looks like her audio connection has disconnected. Oh, and it's back. Okay, I will try to request to unmute once more. And Lindsay, you are unmuted.
Hello, can you hear me?
Yes, we can hear you now.
Oh my gosh, I'm so sorry about that. You would think I would know how to do this by now. I apologize. This is Lindsay Gullahorn with the California Retailers Association, and just wanted to note that we are in support of this bill. Thank you.
Thank you, Lindsay.
All right, this is the moderator. Appears that was our only request for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you, Sarah. Okay, we're gonna, with a motion and second and public comment, we're gonna go for the vote. Just to clarify, the amended also included a delay in implementation. So, Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose, and I vote yes. The motion passes unanimously. All right, moving on to Assembly Bill 2265, or UMBLA, would require a pharmacist to dispense a Schedule II drug in a lockable vial as defined, as well as provide a copy of the opioid fact sheet for patients published by the Federal Centers for Disease Control and Prevention. It would further require the pharmacy to maintain the alphanumeric passcode where applicable in patient's record. The measure would also establish exclusions to the provisions, including if the prescriber indicates in the prescription that the patient requested not to receive their medication in a lockable vial. Further, it would require the board to establish a reasonable minimum and maximum amount of reimbursement that include the costs of the vial and services rendered and dispensing costs. Provides that a manufacturer must pay to compensate the pharmacy and establishes that a civil penalty may be assessed and recovered if the manufacturer fails to reimburse the pharmacy. I agree with the staff recommendation to establish an opposed position on this measure and believe such action would be consistent with the previous policy of the board. I believe the same concerns exist with this measure, including safety concerns from some populations, as well as questioning the necessity for providing the specified fact sheet, as not all Schedule II controlled substances are opioids. Further, the board expressed concern that the provisions could impede patient care and medication adherence. I also agree with the staff's concern that the board would not be the appropriate entity to establish a reimbursement rate for goods and services. The board also questions whether it can reach manufacturers who do not distribute their drugs into the state but use wholesalers or 3PLs as jurisdictional nexus to impose such reimbursement rates or assess fines and penalties. Regulations would most likely be necessary to implement these provisions. Members, any comments or anyone willing to make a motion for our staff recommended position?
Hi, this is Maria Serpa. First, I'd like to thank the staff for their really well-written evaluation, and it shows us that oftentimes good ideas don't necessarily are the best for patient care. So I would support the motion of oppose in this situation.
Thank you, Maria.
And I would second that.
Thank you, Jose. Thank you, Jose. Appreciate that. All right, with a motion and second, any other member comments? Okay, hearing none, we're going to go for public comment in Sacramento. Okay, no takers here. Any public comment in LA?
No public comment in Los Angeles.
All right, thank you. Okay, with that, moving on to public comment in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I do have two individuals who have requested public comment, so I'll go in the order that they were received. First with Paige Talley, and Paige, I will request to unmute your microphone. Once again, you'll be given 2 minutes to speak and a 10-second warning.
Thank you, moderator. Paige Talley with the California Council for the Advancement of Pharmacy. We want to thank the board for taking an opposed position. We opposed this bill last year, and we oppose it this year for a variety of reasons, all that you mentioned, Dr. O, but also that it's duplicative. We already have a bill that is not mandatory, but it does require pharmacies to show lockable vials. And we think it's an unnecessary bill. Thank you.
Thank you, Paige.
All right, this is the moderator. Our next individual who has requested public comment is Lindsay Gullahorn. And Lindsay, I will request to unmute your microphone now.
Thank you. Good morning again, President O, board members. This is Lindsay Gullahorn with the California Retailers Association and National Association of Chain Drugstores. Just want to echo Ms. Talley's comments and thank the board for the opposed recommendation. We opposed the same bill last year, and we opposed this bill for all the reasons stated. I think the biggest thing here is patient access. A lot of patients might not have the ability to open a lockable vial and might be left without access to their medication when they need it. And also think that this will increase drug costs, since pharmacies would be forced to front load the cost of the lockable vials and potentially reduce competition in the drug market, especially the generic drug market, and raise costs for the Medi-Cal program. But most importantly, this is a patient safety issue. So we agree with the board, and we are also opposed. Thank you.
Thank you. Thank you, Lindsay.
All right, this is the moderator. It appears that was our last request for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you. Okay, with a motion and second and public comment received, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose, and I vote yes. The motion passes. All right. Moving on to the next bill is Assembly Bill 2948, Cooper. Assembly Bill 2948 would require the board to send a closure letter to a complainant within 60 days of the closure of the investigation. I agree with the staff recommendation to establish a support position, but also note that given the measure has not been scheduled for hearing, it is possible that it will not move this year. I appreciate your comments and thoughts on this measure.
This is Maria Serpa. I move to support as recommended by staff.
Thank you, Maria. Anyone willing to second for Maria?
This is Cheryl. I would second.
Thank you, Cheryl. Any other member comments? Okay. We're going to open up for public comment in Sacramento. Any public comments? Okay, seeing none, we're going to go for public comments in Los Angeles.
None from Los Angeles.
Thank you guys. All right, we're going to go for public comment in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or click the raise hand icon. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you, Sarah. With a motion and second and public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose, and I vote yes. The motion passes. So that is about halfway point. It is 9:25. We've been at this about an hour. I think this is an appropriate time for a quick break. So I suggest we take a 10-minute break and we return at 9:35. 9:35. So hopefully everyone can stretch their legs a little bit and take a little break. See you back in about 10 minutes. 9:36. Okay, just a reminder, members of the public in LA who want to inspect the materials for the committee meeting should go to the board staff in LA to inspect the committee materials if needed. Also, I believe we should take a roll call just to be safe. Okay, Maria, are you here?
Present.
Thank you, Maria. Cheryl?
Yes, I'm here.
Thank you, Cheryl. Jose?
Present.
Thank you, and we're still missing Nicole and Shirley. Okay, moving right on to the Senate Bill 731, Durazo, Criminal Records Relief. Under existing law effective July 1, 2022, the Department of Justice is required to review arrest records on a monthly basis to identify arrest and conviction records that are eligible for record relief under specified conditions. This measure would make the current provisions effective for arrests that occurred on or after January 1, 2021, and would expand many of the provisions to include any felony arrest or conviction under specified conditions. Further, the measure would prohibit state or federal summary criminal history information from including records of arrest or convictions that were granted relief unless the records required the record holder to register as a sex offender or other conditions. The board established and opposed unless amended for the reasons stated in the meeting materials. The board staff was previously advised that the author's office intends to move this bill this year. However, the measure was recently placed on inactive file. Suggest no change and request the staff monitor to ensure the measure does not move. Members, any comments or thoughts? Okay, hearing none. We're going to go open up for public comment in Sacramento. Any public comment? Okay, don't see anyone here, so we're going to move on to public comment in LA.
None at this time.
Thank you guys. And we're moving on to public comment on Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. Okay, moving right on to the next bill, Senate Bill 872. Pharmacies Mobile Units. 872 would permit the board to issue a license to a city or county to operate a mobile unit to provide prescription medications within its jurisdiction to individuals without a fixed address, individuals living in a county-owned or city and county-owned housing facilities, and individuals enrolled in Medi-Cal plans operated by the local jurisdiction or health department. I agree with the staff recommendation to establish a support, if amended, position. I agree with the identified areas for amendments to clarify several provisions, including inventory provisions, PIC requirements, provisions for pharmacist care, and security requirements. Members, any comments or anyone willing to make a motion for our staff recommended position?
This is Cheryl. I would recommend a support if amended.
Thank you, Cheryl. Thank you, Jose. Jose, that was your second?
Yeah, it's just a mute button. Yes.
Okay. Thank you, Jose. All right. And the amended is about clarifying several provisions, including inventory provisions, PIC requirements, provisions for pharmacist care, and security requirements, if that is okay with you, Cheryl.
Yes.
Thank you. And confirming with Jose.
Yes.
All right. Any other member comments? Okay. All right. With that, we're going to open up for public comment in Sacramento. Okay. I don't see anyone here, so we're moving on to public comment in LA.
None at this time.
Perfect. Thank you. Thank you for letting us know. All right. Moving on to public comment on Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. Okay, with a motion and second and public comment received, I will now take a roll call vote. All right. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. And I vote yes. The motion passes. Okay, the next bill is Senate Bill 958, Lyman, Medication and Patient Safety Act of 2022. SB 958 was amended on April 18th, 2022, and has been referred to the Senate Appropriations Committee. The measure entitled the Medication and Patient Safety Act seeks to address brown bagging and white bagging. This bill states that it is intent of the legislature to ensure that infused and injected medications and related services remain available to all Californians who need them. The measure and enforcement of the provisions resides with the Department of Managed Healthcare. However, I believe that staff's recommendation to establish a supportive amended position is appropriate, and that there should be a threshold that after which a confirmed number of violations are identified by a particular vendor, the plan may no longer use that vendor. Members, I would appreciate your comments on SB 958. I would also entertain a motion if you believe establishing a position would be appropriate. Members, any comments? This is a complex bill, so it's, I understand. Go ahead, Maria. Any thoughts?
This is Maria Serpa. Just to echo what Mr. President said about the complexity, and we have discussed this in Enforcement Committee and are curious to watch what's happening on the national platform. So I agree with the recommended position of support, if amended, for our state.
Thank you, Maria. Confirming that's a motion?
Yes.
Okay, thank you, Maria.
Yes, that's a motion.
Anyone second Maria's motion?
This is Cheryl, and I second.
Thank you, Cheryl. Appreciate that. Okay, with a motion and second, and any other member comments? All right, we're going to move on for public comment in Sacramento. Any public comment? Come on up. Come on up. Thank you, sir. Yay, we're excited. We're very excited.
How's that? Yeah, okay. There we go. Okay. Hi, John Grubbs. I'm the Chief Pharmacy Officer for University of California Health, and I represent the 5 UC medical centers, and we support this bill. We think white and brown bagging has a negative impact on patient safety, and so we think this is an important bill, and we're supporting it.
Thank you, Dr. Grubbs. Thanks for speaking. Any other public comment here in Sacramento? Okay, I don't see anyone jumping down the aisle, so we're moving on to LA location.
We have one speaker.
Thank you.
Yes, this is Steve Gray, and down here in the Los Angeles area. First of all, I'd just like to comment that I am retired. I'm not working for any health plan anymore or any hospital organization, any PBM or any local pharmacy or specialty pharmacy or any pharmaceutical manufacturer. So the comments I have are strictly my own, but they're based on 40 years of managing all the pharmacy support services for Kaiser Permanente in Southern California and most of California. And I believe that this bill is very complex, but I believe that it is not ready for adoption, and I would urge the Board of Pharmacy to adopt a neutral position at this time until some of the rest of it can be worked out. And here is why. This bill would substantially increase the cost of medical care coverage and thus medical care. Basically what the bill says is that the payers, whether they be a union trust fund, whether they be an employer, whether they be the California government, or any other health plan or insurance company, would have to repay for those drugs whatever the manufacturer charged, plus whatever the hospital, infusion center, medical office did as a markup. And the drugs that are the infusion and injection drugs that are the subject of this bill are very expensive. They're biologicals and pharmaceuticals. The cost of those drugs to the American public, 5% of the patients spend over 50% of all drug costs on those drugs. Think about that. Over 50% of the spend on pharmaceuticals and biologicals in this country is spent on these drugs. So the bill would basically force, like I said, the payers, all types of payers, to pay whatever the pharmaceutical company charged and whatever the markup was. The markup on these drugs at hospitals is usually, it averages 100% and is often much higher than 100%. The average cost of these drugs in a hospital, according to the comments in the analysis comments on the bill, are $7,000, but some of these drugs, of course, the therapy can run into the millions. The bill would also apply to
I apologize for the interruption, but your time is up. Thank you for your comment.
If you can just wrap up your comment, Steve. Thank you.
Okay. It also would apply to capitated physicians who want it, but just keep in mind that whenever you increase the cost of care, you decrease access to that care, usually by the people who need it the most. So that's what this bill would do. It's a huge cost.
Thank you for your comments, Dr. Gray. Any other public comment in LA?
None at this time.
Okay, thank you so much in LA. All right, we're going to move to public comment in Webex, please.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I do have a request for public comment from individual identified as Paige Talley. Paige, you'll be given 2 minutes to speak and a 10-second warning. I will request to unmute your microphone now.
Thank you, moderator. Paige Talley with the California Council for the Advancement of Pharmacy. And we are in support of this piece of legislation for injectable and infused specialty meds only. We are not opposed to oral, suppository, otic, or ophthalmic medications being white bagged or brown bagged, but pertaining to this bill, we do support it. Thank you.
Thank you, Paige.
All right, this is the moderator, and I have another request from individual identified as Linda. Linda, you'll be given 2 minutes to speak and a 10-second warning. I am requesting to unmute your microphone now.
I successfully unmuted.
You are unmuted.
I'm sorry, I'm unmuted. Can you hear me now?
Yes, we can hear you.
Wonderful. Thank you. This is Linda Panofsky with University of California, San Francisco. I want to echo our UC CPO's statements with a few caveats. So in general, there's widespread support of the prevention of brown bagging, especially when white bagging and brown bagging happen as a result of fiscal convenience for an organization that puts patients at risk. However, as mentioned before, this is a very complex bill and a very complex situation. The landscape federally of how medication distribution occurs prevents organizations from making the choice to adopt anti-brown or white bagging practices, as long as the supply chain is dictated by the manufacturer to specific contract pharmacies. There are situations where patients, in order to get the care they need in a geographically convenient location, cannot get the medication from the same provider that's providing the services, such as situations as infusions, or in situations where a patient needs to be dosed according to like an allergic response, for example. To give you one drug example, that would be Palforzia, which is for peanut allergies, which only has a limited supply directly from the manufacturer to a clinic. That being said, I hope that the board does pay particular attention to the wording of the bill to make sure we're not creating an unenforceable situation whereby we're putting the disciplinary action on the provider or pharmacy as a result of being locked into the decisions made by manufacturers. That is it. Thank you for your consideration.
Thank you for your comments.
All right, this is the moderator and appears to be our last request for public comment. Would you like me to close the Q&A panel?
Is it working? Okay. Yes, please, Sarah. Thank you. Okay, with a motion and second and public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
I vote yes, but I'd like to, in the amended portion, I would like that what Steve Gray had to say be considered.
Okay, sounds good. Thank you, Cheryl. Is that
Point of order, we're voting on the motion, and if there's a change in the motion, we should reverse the motion.
Are there any specific adjustment you'd like to make, Cheryl, on the motion?
I recommend supporting it, but the portion that says if amended, I'd like, I'm sure in the amended portion there's a lot of consideration since this is a complex situation. So I'm also asking that what Steve Gray suggested be included in that complex situation of amending it.
Okay, considered. And do you want to give the authority to the president and EO in deciding which path?
Yes, thank you.
Okay, okay, sounds good. Jose, are you amenable to that? Sorry. Sorry.
I didn't make a motion.
Okay. Was Maria's motion? So is that?
So my motion was support if amended without any details. So I think that sounds, Eileen, that sounds correct. I just need to add with the president and staff having the authority to deal with the proposed amendments.
That sounds good. Okay.
For the clarification.
Thank you, Maria. Okay. All right, Maria and Cheryl. So then I think, Eileen, do we have to open up for public comment again?
I would, because in the first motion, we were just talking about what was laid out in the memo, and now we're adding a second part of the if amended.
Okay. All right. We're going to then hold a vote and go for public comment in Sacramento. Okay, I don't see anyone. We're going to go for public comment in LA.
I'll be doing the timer. We have someone in Los Angeles.
Okay.
Yes, Steve Gray. Just to add to my earlier comments, truthfully, there are a few issues regarding patient safety, but those are not issues that can't be resolved by negotiations between the suppliers and the entity that is to administer the drug and the Board of Pharmacy. The Board of Pharmacy has authority over all the pharmacies that are the suppliers here and all of the distribution chain. And what I find is very few, if any, of the details of these problems have been referred to the Board of Pharmacy or have been taken up in negotiations. And I believe, my personal belief, and I think it's supported by the analysis, and the cost analysis has not yet been done by the state. So we don't know how much this is going to cost Medi-Cal, CalPERS, and all the other healthcare providers, but it's billions. It's in the billions just for California. So I would encourage again that the board take a neutral position until all the board members have a chance to read the analysis and do read the analysis, because this is a very complex bill and a lot of the problems can be resolved by the Board of Pharmacy. They still have jurisdiction over the problems. Thank you.
Thank you, Dr. Gray. Any other comments?
None from Los Angeles.
Okay, thank you. All right, we're going to open up for public comment in Webex one more time.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close that Q&A panel?
Yes, please. Thank you. Okay, with a motion and second and public comment, we're going to go for the vote again. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
I'm abstain.
What was it, Jose?
Abstain.
Abstain. Okay, thank you, Jose, and I vote yes. Motion still passes, I believe. 3. Okay, thank you, Eileen. Thank you, Jose. All right, moving on to the next item is Senate Bill 988 Hueso. SB 988 would repeal the requirement that a hospital manage a terminal patient's personal use of medical cannabis in the same manner as Schedule 2 through 4 drugs, as 2 through 5 drugs. As you may recall, last year, SB 988 established provisions for a terminally ill patient within a hospital to access their medicinal cannabis. Late amendments to the measure created conflicts with several provisions of state and federal law. The amendments appear consistent with the language of the letter published in the Senate Journal, wherein the author's office conveyed the intentions of the measure. I agree with the staff recommendation to support the measure as it appears to address the challenges created with the late amendments from last year. Members, anyone willing to make a motion or any comments?
This is Maria Serpa. This was a real challenge for us and for the members of the public because of those late amendments. So I move that we support this bill.
Thank you, Maria. Anyone second for Maria?
Cheryl, and I support.
Thank you, Cheryl. Appreciate that. All right, with a motion and second, any other member comments? Okay. All right, we're going to open up for public comment in Sacramento. I don't see anyone. We're going to go for public comment in Los Angeles.
And at this time.
Thank you. All right. Let's open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit the requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you, moderator. Okay, with a motion and second in public comment, we're going to go for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose, and I vote yes. The motion passes. Okay, the next measure is Senate Bill 1031, Ochoa Bogue. Senate Bill 1031 would reduce the renewal for an inactive license to be 50% of the renewal of an active license unless the board established a lower fee. The measure recently passed out of the Business and Professions Committee and was referred to Senate Appropriations Committee. I agree with the staff's recommendation to watch this measure. I believe staff need to review the measure to confirm this measure does not impact the board's provisions in Business and Professions Code Section 4231. I note that this measure would reduce our revenue by about $250,000 annually. Any comments from members on 1031? Also, anyone willing to make a motion for our position as watch position on this measure?
Hi, this is Maria Serpa. I move that we take a watch position.
Thank you, Maria. Anyone willing to second for Maria?
I would second that.
Thank you, Jose. Appreciate it. All right, with a motion and second, any other member comments? Okay, hearing none, we're going to go for public comment in Sacramento. All right, I don't see anyone, so we're going to go for public comment in LA. Not hearing anyone. All right, thank you, Jose. We're going to go for public comments in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you. Okay, with a motion and second and public comment, we're going to roll call for the vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose, and I vote yes. The motion passes. All right, moving on. Couple more to go. We're almost there. Senate Bill 1237, Newman. Senate Bill 1237 would expand the provisions for a fee waiver for a member of the military called to active duty, and the term active duty would have the same meaning as active duty as defined in federal law. I agree with the staff recommendation to support the measure. I would appreciate your comments on SB 1237. Members? And anyone willing to make a motion on support position?
I will make a motion on the support position.
Thank you, Jose. Anyone willing to second for Jose's motion?
This is Cheryl, I second.
Thank you, Cheryl. Okay. Any other member comments? All right. With a motion and second, and we're going to go for public comment in Sacramento. Seeing none, we're going to go for public comment in LA. Any public comment in LA?
None at this time.
Okay, thank you. All right. And let's open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you, moderator. With a motion and second and public comment received, I will now take a roll call vote. Maria, how do you vote?
Yes.
Thank you, Maria. Cheryl, how do you vote?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose, and I vote yes. The motion passes. Okay, next item is Senate Bill 1346, Becker, would expand provisions for redistribution of unused donated medications. I agree with the staff's recommendation to recommended position to establish an oppose unless amended position. This measure appears to further establish a second tier for medication standards for indigent patients. I'm concerned with a further erosion of safeguards in place to ensure all patients receive safe and effective medications. I share the concerns raised by staff, including repackaging and provisions related to commingling of inventory. I also share the concerns raised by staff relating to record-keeping requirements. I note that staff requested information from the sponsor. However, none have been received yet of the requested information. The unlimited transfer provision, coupled with the lack of record-keeping required, would prevent a pharmacist from identifying and quarantining medication identified by a donating entity if compromised. Members, anyone willing to make a motion to establish a oppose unless amended position on SB 1346?
I would make that motion.
Thank you, Jose. Anyone second for Jose's motion?
This is Cheryl, I will second.
Thank you, Cheryl. Appreciate that motion and second. Any other member comments? Okay. With that, we're going to go for public comment in Sacramento. I don't see anyone, so we're going to go for public comment in Los Angeles.
None at this time.
Thank you. All right, and we're going to go for public comment in Webex.
This is the moderator, and at the direction of the chair, I've opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you, moderator. Okay, with a motion and second and public comment received, we're going to take a roll call vote. Maria, how do you vote?
Yes.
Thank you, Maria. How do you vote, Cheryl?
Yes.
Thank you, Cheryl. Jose, how do you vote?
Yes.
Thank you, Jose, and I vote yes, the motion passes. All right, next item is Senate Bill 1365, Jones, would require the board to post on its website the list of criteria used to evaluate applicants with criminal convictions as specified. Further, it would require the department to develop a process for each board to use in verifying applicant information and performing background checks. The measure would require applicants with convictions to provide certified court documents instead of listing convictions on the application, and would require a board to develop an informal appeals procedure to appeal a license denial. The measure will be considered in a policy committee hearing today. I agree with the staff that a position may not be necessary on this measure. Staff included significant comments about the board's current substantial relationship regulations. If the measure passes, it is most likely that once established, legislative changes would be needed to establish an informal appeals procedure. Regulations may also be necessary. Any member comments on this measure? Okay, hearing none, we're going to go for public comment in Sacramento. Don't see anyone. Any public comment in LA?
None at this time.
Okay, thank you, Jose. And we're going to open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or click the raise hand icon. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you, moderator. Okay, with that, we are done with legislative portions. We're moving on to the next agenda, item 5, regulations, and we're going to combine all the regulation portions. The remaining items for information only as detailed in the meeting materials and associated attachments. The board has a number of regulations in various stages of promulgation. I do not intend to review each as the information is contained in the public materials. I do note that the board currently has 5 regulations undergoing final review by the DCA, Department of Consumer Affairs, 4 included on the agenda as such, as well as the pharmacy technician regulation, which was also recently submitted for post-adoption review. The board has 3 regulations undergoing pre-notice review by DCA, and 4 regulations are with staff to draft the necessary rulemaking documents. All right, members, any comments on any of the regulations? All right, I'm not hearing anything, so we're going to go for public comment in Sacramento. Okay, no one is here to make a comment. All right, moving on to LA. Any public comment in LA?
None at this time.
Thank you, LA. All right, we're going to open up for public comment in Webex.
This is the moderator, and at the direction of the chair, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click the Q&A icon located at the bottom right-hand corner of your Webex screen, or use the raise hand function. I'll go ahead and pause a moment to allow the public time to access the Q&A panel and submit their requests. All right, seeing none, would you like me to close the Q&A panel?
Yes, please. Thank you. All right, members. Before we adjourn today, I'd like to thank everyone for your time and participation. The meeting is adjourned. So we will see you today some members at Public Education Committee, and then if not, we will see all of you at the full board meetings scheduled to start at 2:30 p.m. Thank you, everyone, for participating today. The meeting is adjourned.
Thank you.